everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today is named Dr. Carol Wroblewski. She's not only a psychologist, she's a PCRM cooking instructor. She's certified in a lot of things in the plant-based world. And she's also going to do an amazing recipe. It's a muffin that has chocolate, but it's made with beets. But also, we're going to talk about her 100-pound weight loss. And she did it without bariatric surgery, which is something she works in that field now, actually counseling patients. And we'll find out if she counsels them to get it or not to get it. Please welcome her to the show. It's very nice to see you again.
Thank you so much. It's wonderful to be here.
Yeah, I can't wait because I mean, people love a success story, and 100 pounds is a lot. That's like a person.
I laughingly say I used to carry around a junior high school student with me. So, and in 2004, my last recorded weight was 252, and I know I got up into the 270s. So the day this photo was taken was intern graduation. I used to train master's and doctoral level therapists, and Scott one of my trainees wanted a picture, and I said, please get away from me with your camera. And not long after that, I asked our insurance company at the university where I had worked, do you cover bariatric surgery? And they said, no, but you are more than welcome to pay for it yourself. I consider that a pivotal moment because years later, my health took a turn. My blood pressure was through the roof. My stress level was not good. I was not managing well, and decided to make a lifestyle change after my doctor said, you have 6 months to lose the weight. I don't care how you do it. I care that you do it.
It's tough. Wow.
Sorry.
Oh, that's okay. Did you always struggle with your weight even since childhood?
It is since childhood, history of trauma and abuse, like most people who struggle with weight, and had managed school, grad school life, and pretty much anything through food, and found, and like all of us, had tried pretty much every diet and weight loss scheme to no avail. So when it finally came time to put the food down and find another avenue in my life, it was pretty radical. I lost 70 pounds in the first year, and then the remaining 30 took about 6 months the following year. While I was doing that, I was working the Case Shepherd plan, and Case plan relies on dairy and meat products. And I had heard of Michael Tanner and read his book about dairy, and then had a 2-week vacation where I promised myself no electronics. So the only 2 books I took were The China Study and How to Reverse and Prevent Heart Disease. When I walked off that vacation, that was the last time I intentionally ate meat. So I've not had sugar intentionally for 18 years and 3 months. Accidentally gotten into meat products, but not intentionally. It's sometimes people don't tell you things. And I am primarily SOS free. I don't use oil. I don't use salt. If I do, it is very, very rare. And I've found that over 18 years and 3 months, this is a very livable life, not the horror show that people believe when they say, oh my God, you're vegan, you're plant-based. How do you eat like that? Very well, thank you.
You look amazing. Had you heard about a vegan or a plant-based diet before reading the China Study?
I had friends who were plant-based, and I honestly hadn't paid much attention to it. Once I read the research, because I am data-driven, it was incontrovertible that this was a health-promoting lifestyle. And not long after that, I went to get my certificate at Cornell and came in at a time in 2009, I got to go to the first food addiction summit in Baybridge Island in Seattle. So I got to see Jack LaLanne get his lifetime achievement before he passed. And I heard that research. And not long after, I went to PCRM and said, please, what can I do? to spread the word about plant-based nutrition. And so now recently I've been speaking to med students in second year medical school and to talk to them about plant-based nutrition. And their question is, how do we pitch this to our patients? And so I try to work with them to do that.
That is amazing. What's your first memory of being overweight? How early in your childhood do you recall?
Oh my gosh. Infancy. I just always remember the conversation about, oh, Carol's weight, Carol's weight, Carol's weight. So I did, again, like all of us, every diet known to humankind, including those awful appetite suppressant candies that were diabolical. Who makes appetite suppressant candies? And then I got a hold of them. I'm surprised I'm still alive. I think I ate like half a box. So it was a constant challenge. And again, like so many of us that struggle, it was small gain, and then a victory, and then a regain and more, and the up and down until I was pretty much the worst of it was in graduate school because of the stress and eating my way through graduate school.
Did you tried other methods to lose weight growing up?
I had done Weight Watchers. I will say, when my parents took me to a hypnotist, I still do not prefer chocolate cake. So we got that going for me. But what else have I done? Thankfully, I did not do the Atkins keto paleo. That ship had sailed before and after I had made the commitment to be plant-based. But I had done, thankfully, no appetite suppressant pills. I will say I'm very thankful that I've done no surgery, no medications, only crazy whacked out food plans that did not work.
You know, those candies, I remember they were called AIDS, weren't they? And unfortunately, when AIDS, these were AYDS became an illness, they were kaput.
Oh, and thank God for that. So, I mean, sorry about the illness, but
yeah, no, of course. But that's like, oh, you got to be real careful when you name your product. You know, I mean, I actually had a consultation many years ago with Kay Shepherd, and I love her books, and she's a lovely woman, and she's helped so much helping people understand that sugar and flour, at least for a large segment of the population, are addictive. But man, she just misses the boat with dairy, because even many of her colleagues like Dr. Joan Iflin understand that dairy is so addictive.
I got to meet Joan at a subsequent food addiction summit and conference, and there was more wiggle room to embrace living healthfully without animal products. But I will tell you, working in bariatrics and weight loss, when you work with folks who are trained in a system that believes the party line, it's very, very difficult to get away from that. And when you say we're equivalent, plant-based protein is fine, we don't need the protein that you are hearing that we do, it's a challenge. And for those of us who want to carry the message, we can ill afford getting frustrated because our patients carries a lot of weight while people have their times of trying to understand. Rip Esselstyn was going through with the Engine 2 diet. Coming through Indianapolis, I was the person in the audience with my husband who said, but Rip, where do you get your protein? So I think it's kind of a karmic payback now when I get that question when I'm doing a food demo. So
nice. Well, what do you do now as a psychologist? Are you still working with people?
I am. Well, what I've done is I've retired from full-time practice. I worked at 2 bariatric centers that were certified and accredited by ASMBS, the American Society of Bariatric and Metabolic Surgeons, and their centers of excellence. I'm finished doing full-time psych evals, and what I did was work with people who were either in the medically supervised weight loss plan, who were not being prepared for surgery, but were on a severe shake or weight loss plan, possibly with medications, and then doing psych evals to prepare people for surgery. I no longer do that full time. What I do now is I do emotional eating and I take issue with the phraseology, but I have to speak in the language that I'm permitted to speak to get people where they need to be. I listen to Dr. Lyle. I've spoken with him a number of times, and I do believe that this is environmental. I kind of laughing, I have ordered temporary tattoos that say if it's in your house, it's in your mouth, to hand out to my classes. So I'm doing limited groups. I volunteered at an art museum. I walk a few days a week and ride my bike, and am enjoying partial retirement.
Wow, that's neat. Did any of the patients you had previously counseled, did they actually end up avoiding the surgery because of your counseling?
It was interesting. I had a patient who said, okay, because I would have my picture on my credenza behind me, and they'd say, is that you? And I would say, yes, but I did not have surgery. And they'll say, how much did you lose? When I would tell them that I had lost 70 pounds in the first year and 30 in the remaining 6 months, I had a very lovely African-American lady stop and say, how much am I going to lose? And with bariatric surgery, with any weight loss, the more weight you have to lose, the more quickly you will lose it. She was not someone who had hundreds of pounds to lose. She had about 100 pounds to lose. And I said, you will likely lose it more quickly than I will, and then hit your point, and then you'll have to work on stabilization. And she did say, if I'm going to do this, do I really want to get cut on to do it? So she backed off. I had a number of people ask for information, and that's where being a Food for Life instructor was helpful, because I had the vegan starter kit and information that I would share only if asked. It was an interesting, I felt like I was an undercover spy in the enemy camp. The dietitians who, and I'm going to say, bless all dietitians, they do a great job. When you work in a bariatric practice and you're an RD, you have to promote the food plan that is given to you according to the bariatricians. So even if they were an advocate of plant-based nutrition, they had to be kind of covert, as I did, about being very public about it. So the dietitians would say, hey, Carol, we've got somebody who's interested in speaking about being plant-based. Would you have a consult with them? And then I would speak with them and give them resources and let them go their way. So I have no idea overall how many folks opted for other alternatives, but if they were interested and it was appropriate, I would share that with them.
Wow. What made you decide not to get it?
I'm going to tell you, it was a turn of just dumb luck. It was 2000, and at that time, that's when bariatric surgery started becoming more prominent. And I asked our insurer, and they said, well, no, we won't pay for it, but you're more than welcome to. And at that time, I believe it was in the $40,000 range. Now, if you pay out of pocket, I believe one of the hospitals I was with, it was $24,000 cash handed over. And I forget what the cash amount was at the other practice. I didn't have that kind of money. And now I'm going to say, I think things work out as they did and needed to, because of that, I wound up taking steps to find lifestyle interventions. And that's why I'm also a member of ACLM, the American College of Lifestyle Medicine. I believe our best hope out of the obesity epidemic is through lifestyle intervention. So that started me on the path that got me to wellness and has maintained my health to this date.
Fantastic. Patty's saying, have you talked to Dr. Clapper about your work with medical students? Because that's kind of what he's doing now.
I actually, I've been again, plant-based professionals are the most wonderful people you'll ever meet, and they're so giving. At the first hospital I was at, they learned that I was plant-based, so I got to do the education for the medical residents every year. The first year I had, let's see, Dr. Greger Skyped in, Dr. Clapper has Skyped in. I had Dr. McDougall come and get feisty with the students. It was wonderful. And even Dr. Barnard Skyped in. So they do know, and PCRM has tapped me to speak to local medical schools. I've told them I'll go wherever I can drive. So yes, I love what Dr. Clapper's doing and what all our plant-based professionals are doing to carry the message. I will tell you, sitting with 22 seemingly very young, I'm 62, they were wonderful, diverse, but so young medical professionals. And they're saying, teach me more. We're very open, we're very receptive, but we're in a bind because if we say something to you about your weight, you may be upset with us and we'll get a poor review. If we don't say something to you, are we being negligent and overlooking something that is very necessary in your health and wellness? It's a very difficult road for them to walk. So the way I asked them to pitch it is, in the 1970s, we thought it was a really good idea to drive huge cars that used leaded gas. We painted our homes with leaded paint and we had lead pipes. Now we know that those are all toxic and we're taking pains to back that out. So if someone said, well, if plants are so good for me, why didn't I know that until now? It's easy to say, the science changes, the information gets updated, and we're learning more and more about the evidence supporting how healthful this is. So whatever we can do to support our medical students and our medical professionals, because they are open to sharing this message.
When you were counseling patients, did you talk to them also about the dark side of bariatric surgery? Because not everyone has great outcomes.
I did. When I talk, even at the practice I'm with now, we commonly refer to 30-30-30. 30% of, about a third of patients will be around their desired weight. A little over 30% will regain some weight after surgery, and a third will regain all, if not more, than the weight that they had lost as a result of surgery. I've had folks, as particularly heartbreaking young lady, had bariatric. I've had people who've come in for up to 3 bariatric surgeries. So her first bariatric surgery was the lap band, and it did not work for her. She had the gastric sleeve, and in my slides, I'll show these. And it did not work for her. And as a result, now granted, this doesn't happen all the time, but it is known to happen. She wound up with severe depression from medical issues that were complications. She lost her job, she lost her livelihood, and lost her marriage. When she came to me asking for her third surgery, I said, who are your supports as you go through this? And she said, my family would be horrified if they knew I was here asking for a third surgery. And that is troublesome. It's troublesome about the failure rate. It doesn't happen often. What they do say is that bariatric surgery is as invasive or has complications equivalent to having a child or your gallbladder out. So it's not as risky as it has been, but it can be. What has been difficult, and I wanted to read to you, one of the ladies that I've met through this support group and has become acquainted with, I told her I was going to be on here talking about this. So, hey, Kathy. And she said I could share about her. And she said, I will have to catch the replay if I work at that time, and feel free to use me as an example of a glamour don't. Remember that column in Glamour magazine. I've fallen into all the pitfalls bariatric patients are warned against. The biggest lesson I've learned is that the moment you say, oh, that will never happen to me, is likely it is already happening. And that's why I wanted to reach out and raise awareness. If people are considering bariatric surgery, this is not the easy way out. You have your physiology altered, to have to take vitamins, nutrients, and supplements to fill the gap between the nutrients that you were taking in and what you are metabolizing. You will need that for the rest of your life, and a whole host of other things. So I am not for or against bariatric surgery. I've seen some people who are in medical necessity have their lives come back. I've also seen folks become challenged. The biggest issue is, as we all all of us who've gained and lost weight, it becomes emotionally debilitating. It is one more blow. And then it feels like now I've upped the ante, I've done an even bigger intervention, and I've failed in an even greater manner. What's wrong with me? So I just want to encourage people to redirect, to use the resources that they have, eating healthfully, moving, sleeping, being positive about the hope that they can change without having to have a sledgehammer. Maybe just a little screwdriver would work, or a carrot, and have more hope. So that's the motivation for speaking with you today.
Nice, nice. So what would you like to do first? I know you have a delicious recipe. You have some slides. Any preference on what to do first?
But let's start with the BBC muffins.
Okay, well, then they're for British people only, right?
So I'm going to move this screen. We'll cut off the top of my head, but that's okay. And I'm going to start with, as everyone should know, unless you really want pink or red clothing, when you're working with beets, please always use gloves. Now, when I had these originally, the chef, the young lady at Trailhead Naturals in Indianapolis, made this with raw beets. And I've tried them with raw beets, but I actually prefer them with the cooked beets. And if you're going to do cooked beets, our friends at Costco sell, I love these. Oh, helps if I turn it the right way. These beets are already cooked and peeled and in usable shape. So you can put them in your salads. This is a 1.1 pound container. I use all the beets and the fluid in the beets. So,
yeah, those are, and there's another company called Love Beets that you can find, like I think it's called Love Beets at Trader Joe's, where they're pre-cooked and packaged and fantastic.
And I was listening to one of Dr. Greger's podcasts today, and he was reminding that sneaking vegetables into your food plan every opportunity you can is highly endorsed. This is a great way to do it. Now, for those of you who have said, who are former beet brownies, you got over that, I'm sure. So if you can get over black bean brownies, then you can get used to beet muffins. I'm going to tell you, when you doctor it up, and these don't have to be, these are not complicated and they taste wonderful, but then I'm biased because I eat them. So we've got 10 medjool dates. And as I'm reminded by AJ and all the folks who've worked in it, unless you want to ruin your food processor, take a pit out, make sure that the count of the pits and the separated dates are equal. And I learned this, I went to Cleveland when Dr. Esselstyn was doing the open training for the patients who were going to enter his program. And I learned this from his wife, Anne, the sodium-free baking powder. So we've got that, and then the vanilla bean powder that really is quite lovely. So we're going to put that in there for a little lift. A half a cup of Wondercocoa. Now, if you don't know about Wondercocoa, I don't do well with caffeine. So I found Wondercocoa, and there's no caffeine, no fat, and no sugar, which is very helpful because if I get caffeine, I'm like this all the time. So if you see me on caffeine, I'm like flying around the stratosphere. Then we've got our cup and a half of oats. I use thick cut because I like the consistency that it provides. And that would normally be the recipe. Oh, and my 2 bananas. The original recipe used almond butter, and it was too fatty. And I have a problem with nut butters. It is my crack. So to get away from my nut butter crack, I decided to do bananas. So use 2 large bananas that are ripe. And please do not use frozen bananas that have been thawed. I've tried that. It was an epic fail. So we've got this. And then if you have your as an extra, this is a pro tip if you'd like it. If you have your California balsamics, use your chocolate California balsamics, just a tablespoon or two. That'll amp up the flavor. And again, take the edge off the earthiness of the beets. So, but I didn't have any of that. So I've got some espresso balsamic vinegar. So I'm going to do just a little bit of that. And then we're going to blend her up. We're almost done. Okay, so I will give you the view inside the bowl. It looks like brownie or cake batter, like any other kind of chocolate-based mix. And then I will show you, I usually scoop these and into a container. And what I have for you, looks like I'm doing surgery instead of cooking, are the muffins. Now I'll just show you that the consistency, what is really amazing is they're very moist. They're moist but they're firm enough to hold together. And they almost have that kind of truffle consistency. You would never know there are beets in there. So if you wanted to opt, instead of having a higher fiber black bean brownie, to have the still good fiber, but the beet brownie, this will meet your needs.
I bet nobody would know unless you told them.
I told my husband, who loops in and out of eating plant-based, and he said, I think the comment I always get is, hey, that's not bad. Normal people would like those. So
wait a minute, what normal people? Why are they called normal people?
Exactly. I will tell you, one of my most fun memories of doing Food for Life was that I was at Plainfield High School doing health there, and I had made mini black bean brownies. So I'm standing like a flight attendant, like brownie. And the mother walked up and said, what's in that brownie? Because my son is over there just chowing down on it. And he said that he would like another. I said, he's welcome to as many as he'd like. I said, those are black bean brownies. And she said, oh my God, don't tell him. Just let him eat all that he wants. So he came over and I said, do you want some more? Because I had made hundreds. And I don't know if she ever told him, but she swore me to secrecy and she got black beans in him. So I'm going to say, if you want to get a painless way of getting beets in someone, there you go.
Yeah, fantastic. And things like zucchini, there's so many things, cauliflower, rice, there's things you can hide in food just to bump up the nutrition and nobody will know.
No, it's wonderful, incognito, and very tasty.
I'm sure you've watched, well, I shouldn't be sure, but I hope you've watched my show before, and you know that almost every guest gets the question of what they eat in a day. And I'm sure might be slightly different now that you've maintained this 100-pound weight loss for so long than when you were losing weight, but we would sure love to hear what your eating and exercise habits are.
Well, my eating, and what I have for breakfast, I had half of a spaghetti squash with salsa on it and banana. And I do a time-restricted feeding window. As I age, honestly, I feel better not eating. I know I encourage folks not to eat within 3 hours of going to bed. I tend to do well with 2 meals a day. I will eat a lot of steamed zucchini. There's a wild rice, mushroom, cauliflower bisque I love. And my life has gotten, as I've gotten longer in maintenance of my food plan, I've gotten so much less complicated. So there are going to be days where I'll have, and I have to thank you, AJ. I didn't know what a Japanese sweet potato was. Thank you so much. And then having them air fried after you put them in the refrigerator those are crazy good. So I'll have a bag of Brussels sprouts, a couple of cups of Brussels sprouts and Japanese sweet potatoes. It's not real complicated, but it's very good.
That's delicious. Every day for lunch, I have either the Japanese or the Hana, and it's been 11 years and I haven't gotten sick of it yet.
And you'd ask about my exercise. I walk, now normally Saturdays, I'll do an 8-mile walk and an 8-mile bicycle ride. During the week, I'll do 3 miles every few days a week. I've got, I'm thankful we have a treadmill and spinning bike at home. So if I am watching something, I'll walk on the treadmill or ride my bike. And that's pretty much it.
Nice. Well, great. And how long has the maintenance part been easy or hard for you?
Roller coaster. There are times, I don't know about you, AJ, there are times I just don't think about it. I'm getting ready to go on a cross-country train trip from Chicago to Los Angeles to San Francisco. And I did my homework and I looked at the menu on Amtrak. Bless them, but there's not a lot there that I'm going to be able to do. So I did find that they have a baked potato. I'm going to be able to do that. I'm taking overnight oats. I've got my container. I have my nuts, my dried fruit. I've got some hummus. So one of my bags, I've got everything, I can't believe it, in one backpack for a week. And then I have a separate smaller backpack that is I can eat it, I'm fine with it food. So.
Yeah. You said you had stickers made with, if it's in your house, it's in your mouth?
Yeah, temporary tattoos.
Wow. Can you show me one? That's like, I would love one of those. That's
they're at the office and I will get one to you. So I've told everyone, and like Dr. Lyle says, you have to work harder on your environment than you do yourself. And when I get pushback from the medical patients, as much as the post-bariatric patients, about there's something about identity, and especially in women's identities, about fooding each other is what I call it. How can someone come to my home and I don't offer them cookies? I said, because you won't try to kill them then. And they look at me like, you're horrible. And I said, I'll cop to that. There are ways to love on people and to make them feel special and valued without having to food them. And that is a huge issue. We're getting ready to do some special groups at the hospital at the bariatric practice on how to survive the holidays. And I talk to people about, there are times when I will say, you may want to rethink if you go to an event, if it's going to be that much of a trigger. You know who the food pushers are, and please don't be one. I always ask folks, if you aren't willing to not engage, the most you can do is don't contribute to this by fooding other people and goading other people.
Yeah. Good advice. Well, you must be very happy because having accomplished what you've accomplished, and proud even.
I will tell you that I have not done it alone. I have a support network, and I will tell you that on my walks, I listen to your podcast all the time. I'd have to say I'm probably in the 75 to 80% of listening to all your podcasts, because I can walk and learn. My walking is my therapy, being out in nature, and then I can listen and learn. And I have gained so much from the professionals that you've had on your show, and I owe you a great debt of gratitude.
Well, thank you. I'm glad to help. You want to share your slides now? I can't wait to. I love slides. You're doing everything, personal story, and you're like the whole deal.
Well, I've got this up on the desktop. What do we do?
So you push the little green button at the bottom of the toolbar that says share screen.
at the bottom of the tool.
Well, on mine, it's at the bottom. I think it should be on Zoom on the bottom. We should have maybe practiced before the show.
I know. Well, and I'm using my husband's computer because mine honestly literally died right before we started.
So there's usually a toolbar at the bottom. Maybe move your kind of mouse around, and there's a thing that says mute, stop videos, participants, chat, share screen.
Okay, I've got setup, I've got record, I've got recording.
Share screen is usually to the left of record.
To the left of record. I've got, mine says, I'm sorry to say, it says rehearse timing, slideshow setup, rehearse with.
We should have practiced this before.
I
know. I didn't realize you didn't.
Yes,
I don't know how to help you without seeing what you're seeing.
Absolutely. Let's try. Okay, slideshow.
Are you on a computer or a laptop?
I am on a laptop.
Okay, and nobody's home to help, like a young kid?
Of course not. You know what I can do though? I can talk our way through it if you don't.
Do you want to just send me the slides and I can share this on my end?
Yes, that'd be wonderful.
If you can email them to me, I could probably figure this out to do it on my end.
Got it. So I am.
Hang tight, guys. We got a great presentation.
Okay.
Oh, and while you're doing that, someone asked if you had a lot of excess skin losing 100 pounds and how you dealt with it.
You know what? It was like an archaeological dig. I found bones I didn't know I had. What I did was I just exercised. I've got some abdominal tissue that is excess, but I have not had any surgery. I honestly, when I found my collarbones and my chin, I was amazed, absolutely amazed. So I was kind of like, where did that come from? So, oh golly, there it is. Oh, no. Well, I'm gonna send you a different version, and it is, well, heck, I'm having issues is what I'm having. Oh, I know what I can do. I can do it. Folks, bless you, all of you, for being so kind. And I promise we're going to get this going. There we go. So I've got your email.
Yeah, I think I'll be able to help you if I can receive it.
And I will attach this desktop. Okay. Oh, okay. It's attached. It's downloading. Yes, folks, blow by blow. I know.
I got my email open, just waiting to receive.
I just sent.
All right. All the way from Indiana.
Indianapolis, Indiana. Near Eagle Creek Park, where the first time I went rowing with my husband, we locked doors and went into the water. So that was my auspicious start in rowing.
Wonder why it's taking so long from Indiana to receive. You got my email. Don't say my email, but you.
No. I did. I have.
Here it is. Just got it. So let me get it. And is your family plant-based?
I have no children, and my brothers are not plant-based. And my husband when he is plant-based, his health is amazing. Then he'll have the one bite and then off the beam. And honestly, I can literally see when he is eating clean and not eating clean, you can see a difference in his health. It's pretty amazing.
Do you have to prepare food for him that isn't plant-based?
We have an agreement that we got together later in life, and he said, I cooked before I met you, and it's okay if I cook now. He will try. He said, I'll try much of what you do, but if he's going to cook a pizza with meat on it. He takes care of that himself. And we're at a good place with that. There's no animosity. I will say that as far as environmental cues, though, he has a refrigerator in the garage that's the unclean, the stuff I do not do. And then he's also got the man cave where I was horrified to walk downstairs and I smelled brown sugar cinnamon Pop-Tarts. I thought I was going to lose it. I was like, oh, no, we cannot have that. So he works with me, but yeah, he's not on board completely yet. We're in Holistic Holiday See in March. And he said, I'm going to try one more time to get back on the horse. So everybody say a prayer for Tom.
Yeah. Has he seen like movies like Game Changers?
Oh, he's seen Game Changers. We were there when they premiered Dr. Campbell's the Tom Campbell's movie.
Oh, okay. Tom Campbell's movie or Nelson Campbell's movie?
Nelson.
That was Plant Pure Nation.
Yes, Plant Pure. He's seen that twice. He's seen all of it. I'll tell you it's what Dr. McDougall says. People don't want to hear bad news about the things they love.
Yeah, they want good news about their bad habits.
Yes. Yes.
Yeah. Okay. So I've got them up right here. You're a psychologist. Can't you work some magic on them to get them to do what you want?
We're not supposed to treat our own family.
Okay. All right. Here we go.
We are ethically prohibited. Yes.
All right. So I've got the slides here. Let's see if, tell me if you can see this. Can you see this?
Yeah, there you go.
Let me see if I can get it. There we go.
There
All
we
right.
go.
So you just tell me when to advance.
Okay, let's go to the next one, please. And again, I'm Plain Exclusive. I'm the Indianapolis affiliate for Food for Life. So if in Indianapolis, if someone wants a program, I've done Veg Fest, you name it. And I'm sharing my observations about common barriers to making behavioral changes before and after bariatric surgery, after working in the field for 8 years. I am maintaining 100-pound, maybe 120, it depends. I don't know what my actual start date weight was, for over 18 years without the benefit of surgery or medication. So next slide, please. What I'm going to say is, I know I'm talking to an educated audience. You listen to Chef AJ. I know you listen to Dr. Greger. And I will say, if you have an opportunity, Dr. Greger has done some wonderful slides on the efficacy of bariatric surgery, the benefits, and then the potential risks. But what we do know is that after a period of time, no matter what weight you lose, you will regain it. It talks about long-term dieting. Dieters who've had weight loss, 6 months of weight loss, are going to regain back to 5 to 10% of their starting weight. And next slide, please. Dr. Lyle and I were speaking, and he said, what you do as a long-term person who is maintaining weight loss is what no more than 1 or 2% of the population can or will do, to apply nutritional information and make the commitment to make the behavioral change. And that's hard to say. Now, I don't want to say, oh, since only 1 or 2% of people can do it, then I'm not going to. What I'm going to say is there is hope, and all of your efforts will be rewarded with better health in kind for every change that you make. Next slide, please. I did want to talk about Dr. Garth Davis, who, the book I'm holding in my hand is Proteinaholic. Dr. Davis is a bariatrician. He is very well trained, and he wrote the book Proteinaholic. It's a very good book. And what I appreciate is that he talks to his patients very candidly about being plant-based before surgery. And if they do elect to do surgery, he will work with them to have a plant-based food plan after. I will tell you that I have always wanted to get my hands on what the food plan is, because after bariatric surgery, if you have the gastric sleeve or the Roux-en-Y, your stomach is 1/4 cup. It's 2 ounces. And at the end of the year, it would be no more than a cup if you follow your food plan to the appropriate amount. That does not accommodate a lot of plant material. So that Dr. Davis, if you want someone to check into about being plant-based, especially after bariatric surgery, if you're changing from an animal-based protein stance to plants, I would encourage you to look him up. Next slide, please. The role of psychologist at a psychological evaluation. Now, I will tell you that when people would walk in my office, the first thing I would always hear is, oh my God, you're the person I've dreaded to see the most in this whole process. And I absolutely get it, because there's some kind of feeling that I'm passing judgment. That could be no further from the truth. The guidelines I use are, again, ASMBS, the American Society of Metabolic and Bariatric Surgeons, and there are protocols that I follow. My job is to further, I get often the most time that you get with any one professional at a time in this process. So I'm going to try and educate you more about the potential risks and the potential benefits to assess if there are more services that you need before surgery. Because if you're already severely depressed, we want to make sure that you elevate yourself and get yourself to a more stable place before you move forward. Or are you drinking and drugging? And I'm going to say, folks, when you lie to your psychologist, thinking that this is going to help you to get to surgery more quickly, you may be hastening yourself to a place that you don't want to be. So being honest is absolutely necessary, because what I want is what you want is to be as healthy as possible. It may not be in the timeline that you want, but it can get done. I assess for any acute, serious psychological issues, and then I make recommendations to the bariatric surgeon. So FYI, I am not the gatekeeper. I am not the person who stops you at the door. It's the surgeon. All of the members of the team, the dietitians, the nurses, the psychologist, anyone that you've worked with, offer the information up to the bariatric surgeon, and that surgeon makes the final decision whether it's an issue that is warranting surgery or not. Next slide. There are good things that come out of bariatric surgery. Some of them, they're not even sure. They talk about sleep apnea. I had a lot of truck drivers who, to get their CDL driving license, had to get their neck circumference to a smaller circumference because they had sleep apnea, which affected their driving. It does decrease the risk of heart disease, type 2 diabetes. They're not exactly sure what the mechanism is for reducing type 2 diabetes. Urinary stress and incontinence is an issue. Migraines are alleviated, blood pressure, cholesterol is lessened, and reflux is actually lessened. When we look at the numbers of bariatric surgeries provided, before the pandemic, it was nearly 300,000 in a year. When you look after, it dropped to under 200,000, and now it's growing. The country that comes in closest as far as number of surgery per residence is France. So in the UK, Germany, and Spain, they've performed 9 surgeries for every 1,000 obese persons. And in the US, it's 8 surgeries for every 10,000 residents. Whereas France, it's 5 per every 10,000. So when this is much more common, people are hearing about it more often. What I will say is, when I started in bariatrics just 8 years ago, I was talking to people who were having up to 3 surgeries. Now, insurance companies are writing in that you can have no more than 1 bariatric surgery per lifetime. Next slide, please. The benefits, again, and we can skip this one. PCOS is treated well by this, but there are a lot of benefits of bariatric surgery. So next slide. And then again, we talked about 30-30-30. A third of folks stay around their desired weight loss. One of the issues that is controversial in bariatric surgery is people misperceive how much weight they're going to lose. If you are overweight, you are not going to lose down to where you were when you were in high school. I have some people who were very upset, like, what do you mean I'm not going to weigh whatever it is? They anticipate you lose 70 to 80% of your excess weight. And if you're prepared to risk that, that's great. But we do have a third of folks who will regain 20% of surgery, of their pre-surgery weight back after surgery. And I've had a number of folks who have gained back all, if not more, of the weight they lost through surgery afterward. Next slide. There are 3 surgeries. I'm not going to go into them because, again, I'm psychology, I'm not physiology. What we start out at the entry level is prescribed medications: Saxenda, Contrave, Adipex, Quizmia, Plenity, which is a new medication that they give you that mimics the fiber in food. And I'm going to say, why would you want to pay to have a pill for fiber in food that mimics fiber in food? Just eat your fiber. But that's just my view on that. Then there's the gastric balloon and some lap band. Then we've got lap band, or the Roux-en-Y, where they cut out 80 to 90% of your stomach. And the most severe intervention is the duodenal switch, where they will reroute you altogether. Next slide, please. Yeah. And these are the surgeries. So if you want to see what they look like, on the left, you'll see the gastric band. I have had a number of people who said, well, it really worked great for me when it worked, and then it will slip, it will rupture, and it can be quite painful. I've had patients who could not stop throwing up and they said, I've just got to get this out of me. So then we've got the bypass, where they remove part of the stomach, and then the gastric sleeve. Next slide, please. Overall risks: excessive bleeding, infection, adverse reactions to anesthesia. And I will tell folks who use marijuana that in one of the bariatric week, obesity week is what they call it, I was at a session where they were talking about, why do we worry so much about people who are using marijuana? Well, the receptors where the THC lands is where the anesthesia lands. You do not want to go in and have your anesthesia not work and wake up during surgery. That doesn't happen often, but it can happen. Blood clots, lung issues, breathing problems, leaks in your staples or gastrointestinal system, and rarely death. Then other long-term issues: bowel obstruction, and then dumping syndrome. Dumping syndrome is a condition where when you eat high fat, high salt, very nutrient dense foods, you'll get sick, lightheaded. And I had a patient who told me that she planned when she had dumping syndrome. And I said, please help me understand, I'm not following. She said that on a Friday, she would have fettuccine Alfredo because she missed it so much that she would have diarrhea, nausea, vomiting, and would be physically ill, and then have to spend the weekend recovering so she could be ready for work during the week. And she was planning this. Many patients will have to have their gallstones, gallbladder removed. There is malnutrition, vomiting, acid reflux. Next slide, please. Now, what drives patients to surgery? I've sat with nearly 7,000 people over 8 years. So I'm going to talk to you. If you want the research, I'm going to say Dr. Greger has 3 very well-researched videos on bariatric surgery. I'm going to talk to you about the human element, because that's why I'm here today, is to raise sensitivity of, if you have friends who have had this, it's not the easy way out. It's very difficult. I sat in the office next to the dietitian who had a lady who had had bariatric surgery the week before, who was crying and saying, I want my stomach, can you put it back in? And once it's done, it's done. Next slide, please. We all know the desperation and the hopelessness. Nothing has worked. And we wind up, the less well you feel, the less you want to move. The less you move, the more sedentary you are, the worse your health is. Sleep apnea, the more you're fatigued. When you're fatigued, sometimes people eat because they think that will help them wake up. Then we've got the willpower vicious cycle of eating to comfort stress. And then the more you eat these foods, the more you crave them. And it's a very, very vicious cycle. The worst is the corkscrew down on self-esteem, where you gain weight, you feel bad about yourself, you don't want to go out, you limit your interactions, and it just gets worse and worse. And then we also have the healthcare professional vicious cycle, where I've had people, all of us who've been overweight have had medical professionals who have not been the most kind and caring at times in dealing with us about our weight. Next slide, please. How patients are educating themselves. They're watching My 600-Pound Life. Let's remember that this is a show. It is scripted. They pick sensational stories. And this is how people are educating themselves. The other thing I'll hear is, oh, my aunt, my mother, my friend had bariatric surgery and this or that didn't work for them, so I know everything I need to know. Please remember, we're all biologically individual, even though we are similar to our family members, and that what works for your mother, your sister, your aunt, your friend may not work for you, and that this has to be a very, very individual process. Next slide, please. Causes of obesity. By the time folks are in my office, very often it's been a medical condition that's out of control. So congestive heart failure, type 2 diabetes. I will tell you, after COVID, I've had a number of folks with long COVID, folks who now started to manifest health issues who had never had them before. There's also the medications they were taking were making their weight worse. And it all stacks on one another. Next, please. I don't need to talk about the standard American diet too extensively, other than to say that the folks that are walking into my office, very few have even mentioned if they've tried being vegetarian, vegan. When I ask them, what diets or weight loss strategies have you used? They've all done the over-the-counter or TV nutrient supplements. They've all done Atkins, keto, paleo. They've done any number of shakes, potions, pills, bars. And what I hear is, I don't know how to cook. No one ever taught me how to cook healthy food. Food has to be cheap and convenient, hence the reliance on standard American diet. Processed food is the bane of my existence, to try and encourage people to, even if it's to microwave a bag of vegetables, you'll be so much better off. Next slide, please. We all know the calorie density chart. I couldn't find Chef AJ's online, so I'm using the Plant Strong one. And I talk to people about when you, one of the difficult things for me to hear was, I had a gentleman who was eating 2 large pizzas a day, and he had had bariatric surgery. And he was still eating pizza, and the dietitians were very upset. They said, you know, we're worried about his nutrient quality and whatnot. And the surgeon said, but at least he's not eating the 2 whole pizzas. I consider this a win. And that's very challenging, because the quality of his health is still being compromised through his food choices. So just a reminder, when you are eating more highly processed food, more nutrient dense food, it does make it very, very difficult. And I will tell you that my husband's an old football player. He played at Notre Dame with Joe Montana a million years ago. And what he said was, honey, I can't eat as much as you eat. And I said, well, it's because of what I'm eating. So next slide, please. This is fascinating. Ashley Gerhardt, University of Michigan, asked 750 people, what are the top 10 foods that are trigger foods and problem foods? And those are pizza, chocolate, corn and potato chips, cookies, ice cream, fries, burgers, carbonated beverages, cake or baked goods, and cheese. In the nearly 7,000 patients I've asked, when I've asked which of these are your problem foods, it's all these. And then the 2 that didn't make this list are, what I hear is potatoes in any way, shape, or form, which I find fascinating considering how many of them I eat. But mine don't have butter, cheese, and other things. It's not a gravy boat. And then the other food is pasta. Pasta poses a lot of problems. So, and if you look at the common denominator on these foods, none of them look like where they came from. You don't see a shaft of wheat coming out of the pizza. You don't see the raw cacao out of the chocolate. You don't see anything, because these are Franken foods. And the more of those you eat, the more you wreck your system. Next slide, please. My patients, and again, it may be the folks in central Indiana, but they are living on the dollar menu. It's fast, it's convenient, it's on the way. I don't want to have to work. It's got to be very grabbable. And this compounds the issue, because the more you eat this food, the more you prefer it, but also metabolically, it burns off quickly. And then you want to eat it more quickly because you're not full. It's a very, very treacherous situation. Next slide, please. And like I said, I had patients say, potatoes in any way, shape, or form are a problem for me. Pastas are a problem. But the pastas, I'm hearing folks, we're not talking pasta primavera. Jeff Nelson has a great video on easy meals. And he makes a low calorie density, beautiful vegetable and pasta dish. That's not what my patients are having. They're having fettuccine alfredo with butter and cream and Parmesan. So when I'm asking them to back away from these foods, even the patients who are medically supervised are scared to death. You say rice to them and they're like, oh my God, they get pale and almost pass out. Next slide, please. Juice. The halo effect that juice has is just fascinating to me. I have patients who will say, but juice is good. And I ask a patient, how much do you drink? Because I assess how much water you drink, how much caffeine, how much soda. She said, I drink juice to the exclusion of water. And I said, how much are you drinking a day? She was drinking 64 ounces of juice per day. So if you'll show the next slide, then you'll see, this is a Harvard University, 2009. When you look to at one time, the FDA definition of reduced calories was 7 added teaspoons of sugar in a day, not per beverage, not per food, in your entire day. Then they dropped it to 3 added teaspoons of sugar daily. If you look at one serving, and they say one serving here is 12 ounces of a beverage. When you look on nutrition sites, juice servings are 4 ounces. But you get 12 teaspoon equivalent of sugar in cranberry juice cocktail, more than orange soda, 11, orange juice, 10, and cola. And as AJ has shown with apples, it takes numerous pieces of whole fruit to make juice. When I told my patient, how many oranges can you eat in one sitting? And she said, I don't know, 1, 2. And I said, it takes about 3 to make orange juice. And that's how much you're drinking. You can get that down in no time flat. Now, thankfully, this literally was a scared straight moment for her. When she saw, because her beverage of choice was the cranberry juice cocktail, she did back off of it. And she started losing weight just from stopping the soda. Next slide, please. Caffeine and energy drinks. Caffeine is a huge problem, and it gets to be a growing problem because when you are not eating well, your physiology is wrecked. The half-life of caffeine impacts your sleep. Then you're not sleeping well. Then concurrently, you go back to the caffeine to try and prop yourself up. I had a patient and I said, sir, how much are you drinking of caffeine a day? He was drinking 7 quad venti espressos daily, and that's not in addition to his energy drinks. And I get very concerned about energy drinks because it's a science experiment that we don't know how it's going to come out yet. We've got people taking all sorts of nutrients and supplements in, and I'm having people who are not drinking coffee, who are drinking 6 Red Bull, Rockstar, you name it. And they are having a severe difficulty backing off that. The last thing I'll say is the carbonation. I would love to know what they put in Coke Zero. It's highly addictive. I've had grown men. I had a 6'6" gentleman 400 and some pounds, weeping in my office about, but you're going to have to give that up if you want this surgery. Next slide, please. And then coffee remains a problem. I know we've heard varying data on coffee efficacy and the health benefits. But if it were just black coffee, that'd be one thing. That's not what we're having. It's Frappacappa Fuffuccinos with whipped everything. That is a problem. And now what really is a problem is they're doing the same thing to tea that they've done to coffee. So now there's a tea latte that's just as unhealthy as the coffee latte, and green tea is healthful. I do the See Me decaf green tea because it's darn good. Get the benefits and then no latte. And this is difficult because when I started in bariatrics, they said that in the day, your fluids should be clear. You should have no more than 16 ounces of caffeine a day. Now they're encouraging post-op patients to have no caffeine altogether. Next slide, please. Alcohol, huge, huge, huge issue. We know that alcoholism is a problem. Pre-surgery, I don't want people to go into DTs when they have to stop their alcohol before they have surgery. Then we've got the issue of the prioritization, oxidative priority. When you drink alcohol, no matter what else you've eaten, if you've eaten a really healthy meal, that all goes into storage because your body has to burn off the toxin of the alcohol. Well, if you've had a really junky meal and you have alcohol, that super goes into storage because your body says, this is not healthful, this is not useful. So stopping alcohol before surgery is a huge issue. And it's very difficult because of the French recommendation of a glass or two of wine is health. I talk to people about the bonuses resveratrol in the skins of the grapes. Eat your darn dark grapes. Next slide, please. Cannabis. This is a huge issue because I have had a number of patients who are self-medicating with cannabis. It is legal in many states. Where I'm concerned is, does that precipitate you to eat? And I have a lot of folks who will say, I had one person elect not to have bariatric surgery because they did not want to stop using cannabis as a pain management and for anti-anxiety. I'm just going to say, I don't have a dog in the fight. In Indiana, it's illegal at this point. What I'm going to say is you're not doing yourself any favors. And if you want long-term health and you're going to such degrees to do that, then please reconsider substance use. Next slide, please. Sitting is the new smoking. When I ask my patients, how much are you moving? And I'm not talking about like, put on the spandex, go to the gym, do the thing and make a big deal of it. How much are you getting up and moving? The average answer was 0 minutes a day, 0 minutes per week. The RDs were encouraging, please move. And I'm going to say in defense of my patients, if you're on a walker, if you're in a wheelchair, that's difficult to do. I had patients who were taking like jars and bottles and doing weightlifting. It's not that folks aren't trying. They don't realize the exponential benefit of even a little movement for your mood and your health to help start the process. Next slide. What can we learn with our patients who do struggle with weight? Next slide. This was really difficult for me. These are actual recipes that the RDs are handing out because they recommend, what they say is, when you're cut on, your body needs protein to heal the wound. So what I heard was protein, 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 protein. A preferred snack for bariatric patients was a slice of deli turkey with mustard on it, rolled around string cheese. And, you know, I'm sitting there knowing that in 2015, the World Health Organization designated highly processed meats as a carcinogen. And it's difficult because what the patients are told is you've got to get in your protein. And it takes the national obsession with protein to a whole new level. Next slide, please. And then soda, there's no nutritional value. And then the thing to remember is, again, you're going through heroic efforts to stretch your stomach out. So if your stomach is 2 ounces before surgery and you start putting soda back in immediately, you're going to stretch that stomach out. You're going to have nausea and discomfort. It can interfere with your staple line, and it can slow your healing. Next slide, please. This is fascinating to me. When I ask patients, what is one of the main motivations for you coming to have bariatric surgery? What I heard was, I want to get off all my medications. I don't even like taking vitamins. And I can understand that. Insulin's very expensive. Many of my patients were on an average of like 9 medications. So I get that. But what I don't understand is that they balk at taking the bariatric formulated vitamins after. So you need that to keep you healthy. I had a lady who had her first surgery. She said, my health failed horribly. And I said, what happened? She said, well, I was doing great. And I got my first couple of blood work and I was taking my vitamin. And then it went downhill. And I said, well, what happened? She goes, well, I quit taking my vitamin. And I said, vitamin, health, you continue, wash, and repeat. But there's reticence to do that. And I'm going to say again, this is not an easy solution to have bariatric surgery. You have to be willing to take these vitamins to maintain your health, and you have to be able to afford them in the long run. Next slide, please. Psychological risks. This is difficult because I am not going to whitewash or sugarcoat or whatever euphemism you want to use about the risk of addictions. 1 in 3 to 1 in 4 patients will manifest a diagnosable addiction after bariatric surgery over a lifetime. I've had patients who, one fellow who had very little to drink, went to a Catholic mass. It must have been a fancy church. They had real wine. He took a sip and got pulled over for a DUI. And he said, but officer, I didn't have that much. And he didn't. You will metabolize alcohol differently. And the folks that say, well, I'll go back to alcohol later, I'm going to say you're playing Russian roulette. It's a very, very scary situation. Some patients resume disordered eating after surgery, and others will develop new disorders. I've had patients who've had bulimia and binge disorder that are a lower level that managed it and had surgery and did fine. I've had other patients who never binged before surgery that started afterward. And I have seen a number of patients who will do the chewing, where they'll take food in, chew it to get the flavor, and then spit it out. Mood disorders that are alleviated early in bariatric surgery return to previous levels over long term. Some people say, oh, she's just feeling herself. She's like thinking she's all that after bariatric surgery. The thing to remember is adipose tissue. If you want a really good book, The Secret Life of Fat is fascinating. When you carry extra adipose tissue, there are hormones that the fat puts out, which is estrogen. Estrogen contributes to depression. So if you have less fat, you'll have less estrogen, you'll have less depression. But if you are in the weight gain and re-loss, and you can regain weight very quickly, then the depression may likely return. And lastly, marital problems are very, very frequent in association with bariatric surgery. I've had some people say, hey, I'm just positioning myself to launch out of a marriage. I've seen that. I've had people who were rock solid that have lost relationships as a result of the surgery. Next slide, please. We get sensitive about our food. When patients come in and will say, we'd like for you not to eat the way you've eaten before, there's a fear of judgment, of status signaling, like, well, what we think you're doing is going to be better than what you do. And sometimes people get defensive and then reactive and then go back to their previous foods to kind of show us. There's sometimes said, you know, if what I eat is bad, am I bad? Or what am I supposed to eat? It's if not eating their recognizable diet, many people are completely stymied about what their clean alternatives are. Next slide, please. I will say I'm so sorry that The Biggest Loser was ever produced, because there is such hype around the outcomes. People overestimate how much weight they're going to lose. And if you overestimate how much you're going to lose and you lose some, which is a win, but you don't lose what you thought you were going to lose, then you're despondent. If you want to look at good research, Kevin Hall through the NIH in 2012 did an analysis of the long-term weight loss and metabolic changes in folks who have won and were finalists in The Biggest Losers. When you lose weight, you change your metabolic your metabolic level, and a lot of folks will regain the weight, and it doesn't take much to do it. Next slide, please. And again, the excess expectations are absolutely significant. What folks come into the surgery thinking is, I'm going to lose weight, and when I lose weight, all my problems are gone. I won't have a problem at work. My dog won't bark. My kids won't be fussy. I won't have a problem with my family. And there is some harsh realization of, not only have I lost the weight and life has not magically been perfect, but this takes a lot of work to maintain the weight loss. And that is a challenge. Their biggest fear is, what do I do if I regain the weight? Next slide, please. And judgment. I will say that the reason why I had my picture on the credenza was to let folks know I'm on this path with you. I am struggling, most days like you do. Some days are good, some days are a struggle. They get very fearful coming in after they've failed with bariatric surgery, even asking for help and resources to make sure that they can get their life in a better place. Next slide, please. The costs and financial issues around bariatric surgery. There's a misnomer that eating healthfully is so much more expensive than eating the standard American diet. And I challenge you, when Mary McDougall has talked about how to cook, and they buy 20-pound bags of rice and potatoes. I do know that some of the groceries here will have 10 for 10, and I could buy 10 bags of Brussels sprouts to throw in the microwave. The other issue is there's a perception that eating healthfully is repetitive and tasteless. What fascinates me is the foods that are abandoned, that are newly adopted, the ones they go back to are the old standard American diet. And somehow that never seems to be repetitive nor tasteless. Next slide, please. Lack of family support, as AJ has talked about any number of times for folks who are in her ultimate weight loss group and feeling fabulous over 40. Family support is absolutely crucial. And it will sandbag you. I had a lady who had in her home two mid-20-year-old sons and then her husband, and they demanded that she cook not her food for them. So the agreement that we got to was that the sons got a cooking class. The husband started using processed foods if he wanted that. And when they shopped, the young men had their own cart and she had her own cart, because she was at guerrilla tactics here to do whatever she needed to do to stay healthy. Next slide, please. Body dysmorphia. I will tell you, I struggle with it. I've got skin that looks like drapery fabric, but I'm going to say that thank God that they invented Spanx and spandex. It's my best friend. You're not going to look the way you looked before you gained the weight. You're not going to go back to being who you were in a previous life. You'll be your better and best version of who you are now. And I've had patients who have literally prepaid for their body contouring surgery before their bariatric surgery because they had the funds ready and raring to go. But this is a huge issue. I had a lovely 26-year-old woman come in this kind of moo-moo looking thing, and she'd gotten to her desired weight. And she said, oh, Carol, I got to talk to you. And I said, what's going on? And she said, I hate my body. And I said, help me understand. She said, I got used to big me, but now I'm little me. but I don't look the way I thought I would look. And she said, I'm actually seriously considering regaining some of the weight so I can get comfortable with what I thought I knew of myself. So this is very complex. Next slide, please. The rapidity of weight loss. Most of the weight is going to come off in the first 18 months after surgery. And when we look at body contouring surgery, it's limited by insurance or the financial resources of patients. It's estimated that 20% of post-op patients can afford the procedure. What a patient told me, and I've heard this numerous times, the pannus, your lower stomach, the abdominoplasty, if they pay for it, they'll pay for it. They will not pay for your midsection, and they definitely won't pay for the arms. I will tell you that that is a pretty gruesome recovery from what I've seen. There's splitting and a lot of drainage and whatnot. But there are folks who need it because it's medically necessitated. If you are having non-surgical but significant weight loss, the lack of rapidity in the weight loss may help your skin with elasticity, as I feel like I had. I mean, I'm surprised things went generally back into the vicinity where they started. The expectation of guaranteed weight loss can be an issue. And then the other misnomer is that when you have weight, body contouring, you're going to lose all sorts of extra weight from the skin coming off. And I understand it's really not that much. Next slide, please. And then the body contouring. This was a 2014 graphic, and they talk about 10% were having breast lifts, 9% upper arm, 4% tummy tuck, 9% thigh lift. And it says 7% of total body contouring after weight loss procedures, nearly 45,000. And that only goes up. Now, I will tell you, if you've gone to the extent to lose the weight and have the body contouring, I will say that that skin does stretch right back out if you regain the weight. Next slide, please. The illusion that weight loss is permanent and persistent. Weight loss is a daily struggle. It's something that is absolutely necessary for many people to maintain or improve their quality of life. I totally get that. I've had a lot of people come in and say, I need this surgery to improve the quality of my life, only to come back later and say, I came back to get off all of my medications, but now I'm on different medications and I have different challenges. So I am just advocating, if you need this medically, of course, consult with your physician and your medical team. If you have other alternatives and you are interested in seeking those alternatives, please do so, because there are no contraindications for having a plant-based diet. There is nothing that says that you can't have it. It's all win. So if you're willing to make that step, one of my patients say, well, geez, Carol, don't you eat basically like dirt and lawn clippings? I said, you know what? I like my dirt and lawn clippings. It's still okay. Next slide, please. I'm going to say, please quietly and patiently be an example to others. If you have lost weight, a lot of people have lost weight in a lot of ways that are healthful. Please be a quiet example. Leading by example, living your example speaks volumes. When you proselytize to folks, I will say you can run them off really easily. It's okay to be imperfect. When I teach my emotional eating classes and the cooking classes, they'll say, how perfect are you? And I laugh and I say, some days I'm happy for a good 85%. And I'm human, I foof. But I also am scared to death of going back. And so I go right back because that is my choice. So be an example and don't force your opinion if possible. Next slide, please. And it talks about, when I started in bariatric surgery in 2014, it would take you a year or 9 months to get through the process to surgery. Medicare has now changed the laws and the guidelines so that you can walk in and have surgery as soon as possible, as long as you meet the criteria of your bariatric practice. And I'm going to tell you, I was doing it for 8 years. I learned something new all the time about bariatrics. To learn all that in 12 months is one thing. To learn it in 3 months and then have your body altered is something altogether. Your foot is on the gas. If you do start this process, you finish it in the timeline you set, not the bariatric process. That you can back it off and take time if you want. Next slide, please. Is that it? Are we done?
I don't know your presentation, but it's not advancing anymore. So
I think that's it.
do you think it is? Okay, let me see. I hate to miss a slide if there is enough. Yeah, that number 45, that's it.
Yeah, well, God love you for suffering through it. But what I'll say is, there you go.
That was amazing. I had no idea I was going to get such a wonderful talk. You know, does this concept of food addiction ever come up with the bariatric surgeons? Because at least when I watched the show, My 600-Pound Life, it's like they're not really changing their food.
It's fascinating. No, it doesn't. When I ask the patients, every new class that I have with the cooking class, every new class of emotional eating, I'll say, do you believe in food addiction? And they all say, oh, yeah. I brought the book Dopamine Nation. We're going through it chapter by chapter in the emotional eating group right now because they said, oh, I know I've got food addiction. When it comes to the bariatricians, there's varying levels of awareness, but they don't get that we are wired differently and that we are highly reactive to the sights, sounds, smells, and tastes of food. And that just going back to the same foods you ate before in smaller quantities is not a recipe for success. It's a recipe for more problems. But it's slow going on the medical community really believing this in the way that those of us who've lived it do.
Well, the thing is I think it exists on a continuum and not everybody is suffering with the excess weight or a lifestyle disease, but I think everyone's an addict. And that's why people won't change their diet when they know what they're eating isn't healthy.
Yes. Oh, it's like you'll fry these foods for my cold dead hands is what it gets very defensive. It's comfort. It's memories, it's family associations, it's identity status of I grew up with this. You can still have the memories. You don't have the food. You don't have to have the food as the touchstone. If you want to live to have the memories, get rid of the food.
Yeah, I love that. I love that. That is profound. Can people still work with you? And if so, how?
You know, I'm not doing therapy. If you want to get in touch with me, I'm at carolindy@gmail.com. So it's who I am and where I live in case I ever forget. So CAROLINDY@gmail.com or LinkedIn. Where my energies are now is to do the cooking demonstrations and to work. And if you don't want me as a coach, because I'm a tyrant. I've worked with the folks. I've tried to pull folks along, and I heard Juliana Heaver say something about be a lighthouse rather than a tugboat. I've tugboated my way with a number of people as you have. And if you're going to come kicking and screaming, I don't need to be dragging you. So if you're really interested, or if you're interested in learning about being a Food for Life instructor, please get in touch with me. PCRM is the most amazing organization. But at this point, I'll teach you how to cook. I'll even deliver food to you if you're in Indianapolis area. But past that, I'm still kind of figuring it out.
You know, I love that you brought up so many things like other addictive substances, whether somebody has bariatric surgery or not, like the caffeine, the alcohol, the artificial sweeteners. So many people think these things are benign, but for people with food addictions, they're not.
They absolutely are not. And the longer you hang on to it, it prolongs the agony. And when I have folks who are miraculous about, I got off cold turkey, which I still think is amazing, especially for my severe coughing addicts, they'll say, I feel better, but there's the idea of it that they miss. And So romanticizing about these toxic foods is not helpful.
Wow. Well, this was just a wonderful presentation on so many levels. I would love to invite you to be a guest on the next Truth About Weight Loss Summit, and you can really talk about the truth about bariatric surgery.
I'd be happy to.
Wow. I didn't realize this was going to be so amazing. Well, thank you so much. I really enjoyed the presentation.
Thank you so much, AJ. You're doing amazing work, and keep going, because I got to have somebody on my path with me while I walk.
All right. Thank you so much. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow when my guest is Dr. Rachel Rubin. We'll be talking about sexual health, particularly female sexual health, the bladder, hormones, and especially a disease that I get a lot of questions about that so far none of the wonderful doctors on the show really could answer: interstitial cystitis. Take care, everyone.